Now to a Wink News exclusive. The cost of life-saving medicine is skyrocketing, affecting hundreds of families in Southwest Florida.
Because we know what the cost of diabetes, not only emotional cost, but the financial cost is unbelievable.
Only Wink News anchor Channing Frampton investigates the increasing cost of insulin and what one group is doing here to keep people alive.
It becomes a real scary thing.
PAMELA RIVERA lives in Naples. She's a single parent caring for her 11-year-old daughter Sabine, who has type 1 diabetes.
I've had a lot of friends who, when they first found out, they had no idea what it was.
Type 1 diabetes is a condition where the pancreas doesn't produce insulin, which regulates blood sugar. Without that insulin, people diagnosed with the disease die.
We know a lot of people that don't have insurance, that they cut corners. They don't do what they're supposed to do because they don't have, the means.
Take this pen, for example. A month-long supply of these costs more than $600. The test strips alone, they cost more than $300 for a month. That's because the cost of that life-saving insulin dramatically increased in the last few years. CBS News found prices more than tripled from 2002 to 2013. One drug increased almost 8% last year. Another kind of insulin rose from $300 for a 3-month supply last year to more than $900 this year.
It's horrible. It's horrible. It's
one reason why Tammy Belavage founded the nonprofit Help a Diabetic Child Foundation. It's based here in Southwest Florida and primarily serves Lee and Collier counties.
We purchase diabetes supplies and insulin for children and young adults whose families are struggling financially and cannot afford to get these medical supplies.
She was inspired to help out after her own son was diagnosed and then realized the burden it puts on families.
When I stop and really think about it, I get very angry.
But insulin manufacturers say it's not their fault. For example, in a letter to the U.S. House of Representatives in 2017, the Endocrine Society argues health plans should remove insulin from copays in high-deductible plans. Congress should consider policies that would reduce patient cost sharing, and patient assistance programs for insulin should be less restrictive and more accessible. For Rivera and other families, those solutions can't come soon enough.
We ended up moving back in with my mom, and it's a little tight quarters. But it is what it is, and we make the best of it.
A major adjustment to keep her daughter, who is managing the disease, alive.
I didn't understand that would be something I'd live with forever until there was a cure.
A cure that could save a lot of money and a lot of lives. The Help a Diabetic Child Foundation has helped 400 families in Southwest Florida. We've put a link with this story in the Wink News app to see how you can get help. I'm Channing Frampton, Wink News Now.